COVID cases across Westchester County continue to climb. Several cities are acting fast now to contain the spread, make sure Westchester does not become the epicenter for another outbreak. Mount Vernon Mayor Sean Patterson Howard was joined by other city leaders on Sunday to discuss the numbers. Take a listen.
Yonkers, the last numbers we got for Yonkers was 389, but you have over 200,000 residents, so we understand that. Mount Vernon, our numbers 124. New Rochelle's numbers 257, White Plains 129, Portchester 190, and Peekskill 108. So we're seeing it, and we're even seeing other communities higher up in the county that have more active cases now than they ever had during the first wave. So it's definitely something.
This morning, we are getting a bigger picture about what is unfolding in Westchester from County Executive George Latimer. He's joining me now live. Good morning to you, sir. How you doing?
Good morning. How are you?
Doing well, thank you. So let's get to it, because in your briefing yesterday, you stated that there were more than 100 people hospitalized, and the number of cases across Westchester more than double from a week ago. 3,500 active cases. What do you see as the indication of these spikes here?
Well, what we're watching now is very much what we saw back in the early part of the year in March and April, which is a rapid expansion of the infection. This, I assume, is the second wave. I'm not a scientist, but it looks a lot like it did in the first time around. The number of hospitalizations a month ago were in the 20s, and now we're up over 100, and it's been moving up very quickly. And that's a concern, because as many people as get infected, the next level of concern is how many of those people that are infected wind up in a hospital.
Yeah.
And then, of course, how many of those do we wind up losing fatality-wise? Those are the concerning numbers, and they've been rising now for about 5-6 weeks here.
Yeah, obviously it's a concern. These trends happening all across our region, but when you zero in on specific hotspots, where do you see the most cases in Westchester?
Well, it's really where we have the greatest population density. You saw Mayor Patterson Howard from Mount Vernon, which is my old hometown. That is the most densely populated community in Westchester County. Portchester, the village of Portchester, which is smaller in overall population, is just about as densely populated. And where people live in closer quarters, the virus spreads more easily.
Yeah, obviously.
And so Portchester was designated as a hotspot by the governor.
So what, in these densely populated regions, what is the strategy then to bring these numbers back down?
Well, we have the same tools that we've been talking about now for 8 months. We try to get PPE, masks into these communities, particularly in the hands of poor people and seniors, make sure that they're masked and covered, and sanitizing in as many places as we can, bring it right into apartment buildings, bring it right down to where people cluster. We also have to enforce social distancing, and that includes both the public side of it when you're out in public, but also to try to emphasize it on the private side. And we're communicating to people in the languages that they use, which means that Spanish is very important to us to communicate our public message that way as well.
In the first go around, there were hot spots, there were, I guess, zones that were closed off, right, to outside people coming in. Why isn't that happening this time around when you're seeing the cases go even higher than they did the first time?
Well, it's exactly the same strategy. You had a containment zone, one of them, in New Rochelle back in March, and that the governor proclaimed that. The governor, as you know, has taken on the executive authority above mayors and county executives, whether it's Mayor de Blasio, myself, local officials. So it's the governor that makes these decisions. He has designated in Portchester a yellow and then an orange zone based on the parameters they've created of infection. They have not yet designated any other place in Westchester, but we're having precautionary conversations with different communities along the lines I've just described, communities that have a population of poor and so forth.
I want to talk about schools, because I believe there seems to be a mixed message here for parents. Portchester is designated an orange zone. Schools are fully remote, no indoor dining, non-essential businesses are closed, right? But even though the numbers are going up, elementary schools in the Mount Vernon School District reopened yesterday, allowing students from pre-K to third grade back in the building. So help clarify the mixed messaging around some areas having schools closed, some areas keeping them open.
Well, the mixed messages are because of the zones that are created by the state. When the governor establishes a yellow zone, as he did in Portchester, then orange, that mandates that schools closed.
Okay.
Until that designation happens, it's up to each individual school board. Keep in mind the difference between New York City and the areas outside of New York City. In New York City, you have one singular school district. Outside of New York City, every municipality, every city, town, and village has their own school district and decisions made by their school board. So in Mount Vernon, in Yonkers, and New Rochelle, our bigger communities, Individuals' decisions are being made by then up until the governor makes the determination that the cluster is sufficient enough to warrant a yellow or an orange zone. Orange and red zone designations closes the school. Yellow, the school can operate in a hybrid fashion, part remote, part in place. And those decisions made by the state will govern what those of us at the county, city, and towns do.
Understood. Thank you for clarifying that. And lastly, sir, the first go around, there were obviously these surge in numbers. People were concerned about hospital space, beds, ventilators. Do you have enough supplies, enough beds?
Well, right now we have about 3,100 beds in Westchester County, hospital beds in its entirety. We've got at maximum, about 260 ICU beds. And with hospitalization number at 100, even if that number jumps up, we're well below the capacity that we have available. But Westchester isn't an island. If we see this start to spike in New York City or in other counties in the Hudson Valley, and we have available beds, we're going to use them to accommodate any person that's sick, wherever they come from, the city or the rest of the suburbs. But right now we're okay, and we hope it'll stay that way.
All right, sir, thank you very much for joining us this morning. I do appreciate you kind of explaining things, what's happening in Westchester, giving us a better picture. Thank you. Stay safe to you.
Good to be with you.